Question 1. A hemodialysis patient reports new onset of shortness of breath, a cough productive of frothy pink sputum, and crackles audible in both lung bases. The technician should immediately suspect which of the following conditions? A. Pneumonia. B. Bronchitis. C. Pulmonary edema. D. Asthma exacerbation. Answer: C. Pulmonary edema. This question tests your ability to recognize signs of pulmonary edema, a critical condition for dialysis patients. The keywords shortness of breath, frothy pink sputum, and crackles are classic indicators of fluid overload in the lungs. In dialysis patients, the kidney's inability to remove excess fluid can lead to this life-threatening accumulation, causing the characteristic pink, frothy sputum. Prompt recognition and reporting to the nurse are crucial, as it indicates a need for immediate intervention, such as ultrafiltration during dialysis. Question 2. When monitoring a patient receiving oxygen therapy via nasal cannula, what is the maximum recommended oxygen flow rate before considering humidification for patient comfort and to prevent nasal dryness? A. 1 liter per minute. B. 2 liters per minute. C. 3 liters per minute. D. 4 liters per minute. Answer: D. 4 liters per minute. This question addresses safe practices for oxygen administration, specifically regarding flow rates and humidification. The concept tested is patient comfort and preventing mucosal irritation during oxygen therapy. While lower flow rates of oxygen are generally well tolerated without humidification, flow rates above 4 liters per minute significantly increase the risk of drying out the nasal passages and mucous membranes. Using a humidifier at these higher rates adds moisture to the oxygen, making it more comfortable for the patient and reducing the risk of nosebleeds or irritation. Question 3. A patient with chronic kidney disease on hemodialysis is at increased risk for developing respiratory infections like pneumonia. Which of the following is a primary reason for this increased susceptibility? A. Impaired fluid balance. B. Altered mental status. C. Weakened immune system. D. Reduced physical activity. Answer: C. Weakened immune system. This question focuses on understanding the comorbidities associated with chronic kidney disease, CKD, and their impact on respiratory health. The concept is that CKD significantly compromises the immune system, making patients more vulnerable to infections. Chronic kidney disease directly impairs various components of the immune response, including both humoral and cellular immunity, which means their bodies are less effective at fighting off pathogens like bacteria and viruses. This diminished immune function is a major reason why dialysis patients are at a higher risk for respiratory infections such as pneumonia. Question 4. During routine vital sign assessment, a hemodialysis technician observes a patient's respiratory rate is 28 breaths per minute. This finding is best described as A. Bradypnea. B. Tachypnea. C. Eupnea. D. Apnea. Answer: B. Tachypnea. This question tests your knowledge of common respiratory terminology and vital sign interpretation. The concept is correctly identifying an elevated respiratory rate. Normal adult respiratory rates are typically between 12 and 20 breaths per minute, so a rate of 28 breaths per minute is significantly above the normal range. Tachypnea specifically refers to an abnormally rapid breathing rate, indicating a potential respiratory issue or distress that warrants further assessment and reporting. Question 5. Which of the following laboratory values is most indicative of the oxygen carrying capacity of a patient's blood and is often monitored in patients with respiratory conditions and kidney disease? A. Platelet count. B. White blood cell count. C. Hemoglobin level. D. Serum creatinine. Answer: C. Hemoglobin level. This question assesses your understanding of essential blood components and their role in oxygen transport. The key concept is that hemoglobin, found within red blood cells, is responsible for binding and carrying oxygen from the lungs to the body's tissues. A low hemoglobin level, often seen in chronic kidney disease patients due to erythropoietin deficiency, directly reduces the blood's capacity to deliver oxygen, which can exacerbate respiratory symptoms or lead to anemia-related shortness of breath. Monitoring this level helps healthcare providers assess and manage oxygen delivery to the patient. Question 6. A patient on hemodialysis complains of sudden, sharp chest pain and shortness of breath during treatment. The technician notes decreased breath sounds on one side of the chest. These findings are most concerning for which condition? A. Myocardial infarction. B. Pleurisy. C. Pneumothorax. D. Pericarditis. Answer: C. Pneumothorax. This question tests your recognition of a critical respiratory emergency, particularly important in patients with central venous catheters, which can sometimes lead to this complication. The key symptoms are sudden, sharp chest pain, shortness of breath, and importantly, decreased breath sounds on one side. A pneumothorax occurs when air leaks into the space between the lung and chest wall, causing the lung to collapse, which directly explains the decreased breath sounds and acute respiratory distress. This is an immediate medical emergency requiring urgent intervention. Question 7. When assessing a patient's respiratory status, which of the following is an expected normal finding? A. Use of accessory muscles for breathing. B. Symmetric chest expansion. C. Cyanosis around the lips. D. Audible wheezing. Answer: B. Symmetric chest expansion. This question helps you distinguish normal respiratory function from abnormal findings. The concept is recognizing the characteristics of healthy breathing. When a person breathes normally, both sides of the chest should expand equally and simultaneously, indicating that both lungs are inflating properly. Findings like using accessory muscles, cyanosis, or wheezing are all signs of respiratory distress or an underlying issue and are not considered normal. Question 8. A patient receiving oxygen therapy via non-rebreather mask should have the reservoir bag inflated to what extent? A. Completely deflated. B. 1/4 full. C. 1/2 full. D. 2/3 to fully inflated. Answer: D. 2/3 to fully inflated. This question addresses the correct setup and function of a non-rebreather mask, a high-flow oxygen delivery device. The concept is ensuring the mask delivers the intended high concentration of oxygen. The reservoir bag on a non-rebreather mask must remain at least 2/3 to fully inflated during both inspiration and expiration to ensure the patient receives a high concentration of oxygen, up to 90 to 100%, and to prevent rebreathing of exhaled air. If the bag deflates completely, the patient is not receiving adequate oxygen concentration. Question 9. Which breathing technique is often taught to patients with chronic obstructive pulmonary disease, COD, to help them expel trapped air and improve gas exchange? A. Kussmaul breathing. B. Cheyne-Stokes breathing. C. Pursed lip breathing. D. Biot's respiration. Answer: C. Pursed lip breathing. This question focuses on a common therapeutic technique used to manage chronic respiratory conditions. The concept is understanding how specific breathing exercises can improve respiratory function. Pursed lip breathing involves exhaling slowly through pursed lips, which helps to create back pressure in the airways, preventing them from collapsing and allowing for more complete exhalation of trapped air. This technique reduces shortness of breath and improves ventilation, making it a valuable tool for patients with COPD. Question 10. A patient's arterial blood gas, ABG, results show a pH of 7.30, PaCO2 of 55 mm of mercury, and HCO3 of 24 milliequivalent/L. These values are most consistent with which acid-base imbalance? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Answer: A. Respiratory acidosis. This question tests your ability to interpret basic arterial blood gas, ABG, values to identify an acid-base imbalance. The concept is recognizing the classic pattern of respiratory acidosis. A pH of 7.30 is acidic, below the normal range of 7.35-7.45, and a PaCO2 of 55 mm of mercury is elevated, above the normal range of 35 to 45 mm of mercury. Since carbon dioxide is an acid in the body, an elevated PaCO2 directly explains the decreased pH, indicating a primary respiratory problem causing too much acid retention. Question 11. Which of the following is a potential respiratory complication associated with a central venous catheter, CVC, insertion that a dialysis technician should be aware of? A. Hyperventilation. B. Asthma exacerbation. C. Pleural effusion. D. Pneumothorax. Answer: D. Pneumothorax. This question highlights a critical complication related to central line placement, which is a common access method for hemodialysis. The concept is recognizing potential procedural risks. During the insertion of a central venous catheter into the subclavian or internal jugular vein, there is a risk of inadvertently puncturing the pleura, the membranes surrounding the lung. This can lead to air entering the pleural space, causing a pneumothorax, or a collapsed lung, which is a medical emergency. Question 12. A patient with end-stage renal disease, ESRD, may present with Kussmaul respirations. What is the primary metabolic imbalance driving this specific breathing pattern? A. Respiratory alkalosis. B. Metabolic acidosis. C. Hypokalemia. D. Hypernatremia. Answer: B. Metabolic acidosis. This question links a specific respiratory pattern to a common metabolic issue in ESRD patients. The concept is understanding the body's compensatory mechanisms for acid-base imbalances. Kussmaul respirations are deep, rapid, and labored breaths, which the body uses to blow off excess carbon dioxide and acid E to compensate for severe metabolic acidosis. In ESRD, the kidneys cannot excrete acids, leading to their accumulation and a drop in blood pH, prompting the respiratory system to try and correct it. Question 13. What is the primary purpose of a spirometry test? A. To measure heart rate variability. B. To assess kidney function. C. To evaluate lung function and airflow. D. To monitor blood glucose levels. Answer: C. To evaluate lung function and airflow. This question defines a common diagnostic tool used in respiratory medicine. The concept is understanding the basic utility of a spirometry test. Spirometry is a simple test that measures how much air a person can exhale and how quickly they can exhale it, providing essential information about lung volume, capacity, and airflow. It is widely used to diagnose and monitor conditions like asthma and chronic obstructive pulmonary disease, COPD. Question 14. When educating a patient with a respiratory condition about preventing infections, the most important advice to provide is A. Increase fluid intake. B. Practice deep breathing exercises. C. Get regular vaccinations, e.g., flu, pneumonia. D. Avoid strenuous activity. Answer, C. Get regular vaccinations, e.g., flu, pneumonia. This question emphasizes a crucial preventive health measure for vulnerable patients. The concept is primary prevention of respiratory infections. While all options might be beneficial, vaccinations for influenza and pneumonia are by far the most effective strategies to prevent these common and potentially severe respiratory infections, especially in individuals with compromised respiratory systems or weakened immunity, like many dialysis patients. Question 15. A patient on hemodialysis reports experiencing dyspnea, shortness of breath, during dialysis treatment. Which initial action should the technician take? A. Increase the blood flow rate. B. Administer an anti-anxiety medication. C. Assess vital signs and notify the nurse. D. Reposition the patient to a supine position. Answer, C. Assess vital signs and notify the nurse. This question tests the appropriate immediate response to a patient complaint during dialysis, prioritizing patient safety. The concept is prompt assessment and communication when a patient develops symptoms. Dyspnea can indicate various serious issues, such as fluid overload, an allergic reaction, or a cardiac event. The technician's role is to gather objective data, vital signs, and immediately alert the primary nurse for further assessment and intervention, ensuring the patient receives timely and appropriate care. Question 16. What is the most common cause of acute bronchitis? A. Bacterial infection. B. Viral infection. C. Fungal infection. D. Allergic reaction. Answer, B. Viral infection. This question assesses knowledge about the etiology of a common respiratory illness. The concept is understanding the typical infectious agents responsible for acute bronchitis. Acute bronchitis is most frequently caused by viruses, such as those that cause the common cold or flu. While bacterial infections can occur, they are far less common as the primary cause of acute bronchitis, and antibiotics are often not necessary. Question 17. Which of the following conditions is characterized by inflammation and narrowing of the small airways, leading to wheezing, coughing, and shortness of breath, often triggered by allergens or exercise? A. Pneumonia. B. Emphysema. C. Asthma. D. Pleurisy. Answer, C. Asthma. This question describes the classic symptoms and triggers of a common chronic respiratory disease. The concept is correctly identifying the characteristics of asthma. The keywords inflammation and narrowing of the small airways, wheezing, coughing, and shortness of breath that are triggered by allergens or exercise precisely describe an asthma exacerbation, where the airways become hyperresponsive and constrict. Question 18. A patient is prescribed a bronchodilator inhaler. What is the primary action of this medication? A. To suppress a cough. B. To thin respiratory secretions. C. To open up the airways. D. To reduce fever. Answer, C. To open up the airways. This question focuses on the pharmacological action of a common respiratory medication. The concept is understanding how bronchodilators work. The name bronchodilator itself is a strong clue, meaning it dilates or widens the bronchi, which are the main air passages to the lungs. These medications relax the smooth muscles around the airways, making it easier for air to move in and out, thereby relieving symptoms like wheezing and shortness of breath. Question 19. When performing chest compressions during CPR, what is the recommended depth for an adult? A. At least 1 inch, 5 cm. B. At least 2 inches, 5 cm. C. At least 3 inches, 5 cm. D. At least 4 inches, 10 cm. Answer, B. At least 2 inches, 5 cm. This question tests critical knowledge in emergency medical response. The concept is adhering to current CPR guidelines for effective chest compressions. For adult CPR, the American Heart Association recommends compressing the chest to a depth of at least 2 inches, 5 cm, but no more than 4 inches, 6 cm. This depth is crucial to create enough pressure to circulate blood to vital organs. Question 20. Prolonged immobility, often seen in hospitalized or critically ill patients, significantly increases the risk for which respiratory complication? A. Seasonal allergies. B. Rhinitis. C. Atelectasis. D. Sinusitis. Answer, C. Atelectasis. This question highlights a common respiratory problem associated with patient mobility. The concept is understanding how lack of movement affects lung function. Atelectasis refers to the collapse of lung tissue or air sacs, alveoli. When patients are immobile, they often take shallow breaths, and the lack of deep breathing and coughing can lead to secretions pooling and alveoli not fully expanding, increasing the risk of these areas collapsing and reducing oxygen exchange. Question 21. Which of the following describes the most appropriate placement for a pulse oximeter probe? A. On an earlobe with a history of frostbite. B. On a finger with artificial nails. C. On a toe, avoiding areas with poor circulation. D. On a site distal to a blood pressure cuff. Answer, C. On a toe, avoiding areas with poor circulation. This question addresses the practical application of a common diagnostic tool. The concept is ensuring accurate pulse oximetry readings. To get a reliable reading, the pulse oximeter needs good pulsatile blood flow, so choosing a site like a toe that is free from restrictive clothing, artificial nails, or impaired circulation is crucial. Using a finger with artificial nails or a site with compromised blood flow can lead to inaccurate or no readings, compromising patient assessment. Question 22. What is the primary function of the diaphragm in the respiratory system? A. To filter inhaled air. B. To produce vocal sounds. C. To facilitate inhalation and exhalation. D. To protect the lungs from injury. Answer, C. To facilitate inhalation and exhalation. This question focuses on the fundamental mechanics of breathing. The concept is understanding the diaphragm's role in respiration. The diaphragm is a large, dome-shaped muscle located at the base of the lungs, and it is the primary muscle of respiration. When it contracts, it flattens and moves downwards, increasing the volume of the chest cavity and drawing air into the lungs. Inhalation, when it relaxes, it moves upwards, decreasing the volume and pushing air out. Exhalation. Question 23. A patient presents with a sudden onset of productive cough, fever, chills, and pleuritic chest pain. These symptoms are most consistent with which respiratory infection? A. Common cold. B. Influenza. C. Pneumonia. D. Pharyngitis. Answer C. Pneumonia. This question describes the classic presentation of a serious lung infection. The keywords productive cough, fever, chills, and pleuritic chest pain, sharp chest pain that worsens with breathing, are all hallmark symptoms of pneumonia. Unlike a common cold or flu, pneumonia involves inflammation and fluid accumulation in the lungs' air sacs, leading to these more severe and localized symptoms. Question 24. A patient who is experiencing significant anxiety may exhibit which of the following respiratory patterns? A. Bradypnea. B. Hypoventilation. C. Hyperventilation. D. Apnea. Answer C. Hyperventilation. This question explores the connection between psychological states and respiratory responses. The concept is understanding how anxiety can affect breathing. Hyperventilation, which is rapid and often shallow breathing, is a common physiological response to anxiety, panic, or stress. It leads to excessive exhalation of carbon dioxide, which can cause symptoms like lightheadedness and tingling. Question 25. What is the expected color of sputum that indicates a bacterial respiratory infection? A. Clear or white. B. Yellow or green. C. Pink and frothy. D. Black or dark brown. Answer B. Yellow or green. This question tests your ability to interpret visual cues related to respiratory secretions. The concept is that the color of sputum can provide clues about the type of infection. While clear or white sputum is often associated with viral infections or irritation, yellow or green sputum is typically indicative of the presence of white blood cells fighting a bacterial infection, giving it its characteristic purulent appearance.